All right, so welcome to the Dr. Alo Show. I have an awesome, pleasant, hilarious guest for you today. This is Dr. Jason Smith, and the reason I wanted to bring him on is because nobody that I've met ever knows more about concussions than Dr. Smith. Some of you guys know me, I coach a lot of sports. I send him all my athletes, including my own daughter, who I feel like after she saw Dr. Smith got a whole lot better. I feel like we need a little bit of education on what are concussions, what's the return to play situation now, because I remember back when I was in residency 20 years ago, it was a lot different. And just give us some updated guidelines and kind of what is the current situation in terms of concussions, how you diagnose them. You're on the sidelines a lot. Tell us kind of like when you're evaluating somebody on the sidelines, what do you do? Why don't we start with introduce yourself and let us know what you do and why you do it.
Yes, thanks, Dr. Alo. My name is Dr. Jay Smith. I'm a primary care sports medicine doctor, and what that means is about 95% of injuries that happen on the field or happen in athletic-related events do not require surgery. I'm the 95%. The 5%, those are the wonderful orthopedic surgeons that take care of the musculoskeletal injuries, but there's no one better from a medical standpoint to deal with your child or your own concussion than a sports medicine physician. We are specifically trained to deal with these medical injuries. My background's a little different. I would like to call myself a unicorn. I think that's fairly fair.
Sounds about right.
Yeah, I was a former
the colorful type.
Unicorns are rainbows, man. I was a 3-sport Division I and II college athlete.
What sports would those be?
Yeah, can you guess? Do you know?
I would guess. Let me guess.
Okay, ready? We'll give him 3 guesses.
Okay.
I guess he's going to get wrong all 3 of them.
All 3?
All 3.
I think you're
going to go for 3.
All right, I'd say wrestling.
Nope.
Okay. Football.
And you're 0 for 2. And let's just wrap that up. Just throw something out there.
Rowing?
Yeah, no.
What are they?
Yeah, so ironically, I went to college to run Division II cross country. I ended up getting a swimming scholarship. I really wasn't the world's best swimmer, but I tried really hard. And for some reason, the coach put me on the team for the GPA, Academic All Conference, GLIAC, early 2000s, don't remember which year. And then I finished playing Division I water polo. Probably the only person in Toledo that actually played Division I water polo that admits it 25 years ago now. I then went to med school at the Philadelphia College of Osteopathic Medicine, did my residency and fellowship at the Cleveland Clinic Foundation, where I worked for the Indians, the Browns, the Cavs. Since then, I've been in multiple different settings and I'm currently in private practice here in Toledo. You can find us at ToledoSportsDoc.com or on Instagram, The Fly Sports Doc. And we could go into why that is. It's a play on words for some of the weird unicorn things that I do. But probably the most unique thing that I do is on my hat. I'm probably one of 10 or less.
Tip your hat down a little so I can see it.
10 or less physicians who works full-time in professional wrestling. So I work for All Elite Wrestling, AEW. It is the second largest wrestling company in the United States. We have shows on TBS and TNT's Wednesdays and Saturdays, and we actually have a pay-per-view coming up very soon. So I get to travel for that and go to cool places like Sacramento, California, just got back, and Los Angeles. So that's kind of my background. When it comes to sports-related concussions here in Toledo, from a volume standpoint, I'm not quite sure there's another doctor that sees as many as I do. And there's a good reason for that. I actually care quite a bit about the injury. And it is my own personal experience of suffering 2 back-to-back concussions in college that very much affected my mood, my behavior, and the fact that I did not, and I think certainly at the time, we did not understand the pathology of the disease. And I hate using those big words, but from what we came from literally just 25 years ago when we started looking at sports-related concussions as an actual entity to where we are today in 2025, it's quite spectacular. We went from just sit out and you'll get better eventually, maybe,
to
an actual structured program for both return to learn to return to play. And we adapt these to very unique situations, things like professional wrestling, which if you look, there is no real playbook for how to bring an athlete back professional wrestling. And especially if you know anything about it, and I'm still learning, having been there for a year and a half now, is that you always have to structure things toward the athlete. So we are getting into more and more specialization of treatment of these injuries, specifically for the specific things they do in sport. And I think that's really important because most parents, and if we weren't doctors, we would probably take our kid to the ER if they had a concussion.
Or the pediatrician.
Or their pediatrician.
Which is what I did, and that's why I wanted to bring you on. We had originally, my daughter plays soccer. I probably sent you the video of her injury. She was running at the goalie. She's a striker. She was going to the goal with the ball. The goalie came out, which is what we teach goalies.
Rightfully
the goalie
so.
came out correctly.
As a former college goalie.
There you go. See, we're on the same wavelength. The goalie came out to take the ball from her. She wasn't going to be able to get around the goalie, jumped over the goalie to avoid the goalie, landed and rolled, but her teammate tripped over the goalie and landed on her. She hit her head against the ground and then hit her head against her teammate and then back against the ground again. We had taken her to her pediatrician, and I don't remember what they did because I wasn't there, but it was like a 3-week process. And it was like, this can't be real. Like, I mean, and I get it. I mean, I coach sports too, and I've sent my kids to, like, I coach football, which is even worse for head injuries.
Not actually. Actually, yes. So you bring up a great point, and I didn't want to cut you off because you had such a great story, but quickly want to say this. The number one sport for sports-related concussion is girls and women's soccer. So there's a lot of reasons for that. We can get into it. But Dr. Alo's story is very important. No, I want you to continue to tell the story.
So
very important.
The rest of the story is we had taken her to the pediatrician, and I coach football, and they collide, and sometimes it looks like a kid had a concussion. And, you know, when you see it, you know, but we'll get into like how you diagnose it officially, because I'm a cardiologist. It's not my specialty.
They make us went to Hogwarts.
They make us take online courses on concussions and how to diagnose them, because any parent coach should be able to at least kind of know. But obviously being a doctor, it's a little different. So you know when you see it, at least for me. And for you, obviously, there's more involved. You can tell us that in a second. But we took her to the pediatrician. They went through a bunch of testing and whatnot. Eventually, they let her back into play. And then she was dehydrated one day. I don't know what's going on with her. She didn't feel right.
I remember this.
She didn't feel right. The coach made her sit down. He's like, come over here. Something's not right with her. She hadn't eaten or drank. She was getting a nervous stomach because it was her first day back to playing. She had a nervous stomach. She didn't want to eat or drink because she didn't want to get throw up or something. Understandable. We took her back out again. That's when I called you and I said, dude, what do we do? So talk me through the process of diagnosing a concussion, and then what do you go through to get the athlete back to the game? Yeah.
So there's a lot. And when I lecture on this, I mean, these literally could be 45-minute lectures just on each parts of these things. That's how complex they are. But let's start with diagnosis. Diagnosis starts with recognition. So the whole point of coaches having these courses to learn about concussions is so they can recognize the signs and symptoms of a concussion. Because I can tell you that loss of consciousness, getting knocked out, you are rarely, if ever, going to see that as a parent, hopefully. That's not necessarily a bad sign, but it seems like an obvious sign. Things like throwing up on the field, these are not that evident. A lot of the times it is a rapidly evolving process, and there's many reasons for that, and I won't go too deep into the weeds with it. But the most important thing is if something doesn't look right, and there may have been an injury that transmitted forces to the head, or there was a direct blow to the head, meaning when we say transmitted forces, say your kid falls backwards, falls on their back, but then they whiplash back and hit their head and hit the back of their head. A very common mechanism that we see for sports-related concussion is just pull them out, give them a minute, let it breathe, let them kind of get their wits about them, and ask about things like headache, dizziness, blurred vision. I could go into all 22 way too quickly, but it would be...
I mean, you could go through the major ones. I mean, you don't have to go deep.
I think that's the big ones.
So the big ones are to look out, headache and dizziness, just they don't just look right. Something's not right.
And I think so much of what I do in being a so-called expert.
Because a lot of times the trainers that are on the sideline didn't actually watch the injury. A lot of times I'm on the field with them and I see two kids collide and the one kid is getting up kind of wobbly. I see it. The guy running in from the lady running in from the sideline didn't really see the injury. She asked what happened. I told her, those two kind of hit each other. The one fell down, and it might be different. So when you walk up to a kid that you didn't see what happened, what signs are you looking for to know if they had a concussion or not? Yeah,
so I'm actually going to go I'm going to one-up you unintentionally, because what we do in pro wrestling is even harder. Pro wrestling is 100% real athleticism, and I think folks should understand that. These folks are impressive, unbelievable, spectacular athletes. The thing they do are absolutely amazing. The one thing that I would say is that there is some scripting. So there are things that when you watch them on television, they look like they were bad. And some of that is very much set up. Now, imagine having to be a doctor trying to figure out what's real and what's not real.
You don't get the script? They don't give you the script?
No, like we don't know. And there are some safeguards in place. And you know, a lot of the times we talk about taking a break and saying, hey, let's walk over to the ring, let's get off the camera, let's ask about some of the things that just happened. You know, what we see, which is challenging and may not be applicable to your audience, is that people forget what's going on. Like they forget the sequence of the next couple moves. The applicable side of that is the fact that somebody might not know if they're on offense or defense. They might not know what play they just ran. One of the questions I used to ask when I dealt with a lot of high school kids on a regular basis was, what'd you have for breakfast that day? I think that's a pretty good question. What's the score? You know, and things like that. Those not quite recognizing the things that you probably could pull up pretty quickly if you thought about it.
So I'll tell you a funny story. One time, a kid was actually knocked out. Okay. So we took him out, obviously. He's standing on the sideline with me. And this was about 7 years ago. He's standing on the sideline with me. He looks at me, he's like, Coach, why am I standing over here? Why am I not playing? I was like, and like to me, at first I was like, oh, damn. Like, so, I was like, well, I can show you the video later.
Very important point Dr. Alo brings up is that if you suspect an athlete has suffered a potential concussion, take a vital piece of equipment. So one of the biggest things, particularly in tackle football, is take the helmet away. You can't play at a football game without a helmet, right? Soccer, take the cleats, you know? Obviously, if it's raining, that's really cruel. If you're into that, that's fine. But take a vital piece of equipment, you know, throw the red jersey over top of them. Find a way where even if they don't remember, or perhaps, you know, when you look at like a college sideline, and I cover Tiffin University as well, I mean, there's 90 to 100 people on the sidelines. You know, the coach may not know that a certain athlete is out.
We all knew.
Well, I'm just saying, in certain
everybody in the stadium knew. Like he was out for a while.
Take a vital piece of equipment.
No, I totally get that, and we took him out. I mean, like to me, it like clicked. Like that question was like, oh, yeah, this guy was out. Like he just looked at me, he's like, Coach, why am I standing over here and I'm not on the field playing? I was like,
I mean, I remember after my first concussion, I couldn't walk. Like I felt like I was drunk walking out. I had to watch the video to remember what happened to me.
Oh, geez.
Yeah, it was pretty bad. I got knocked out in the pool, so that's even scarier. The goalie kicked me.
Polo?
Yeah.
Wowzers.
Yeah.
And you were like out?
And
they had to pull you out?
No.
So you don't?
They had no idea.
Oh, they had no clue.
We didn't have enough athletic
You didn't inhale water?
Don't think so. Maybe that explains things. But so then we go from like, okay, recognition. What do you do next? Because I think like,
the what do you do next part is definitely a question.
Yeah, it's hard.
I think most people can feel it. Like when you see what a kid, the way they're interacting with you, the way they're talking to you, the way they're looking on the sideline, they're just kind of confused. You can kind of tell maybe or for sure they had a concussion.
Yeah.
So then what's the next step? So what do you do then?
Yeah.
Obviously you get them out of the game, like you said.
Yeah, so that's the easy one, right? I think this is where we get harder because this is where, you know, what if you go to an ER? What if you go to an urgent care? What's going to happen? If you go to an ER,
they're going to see to your head.
More often than not, yeah. I feel bad for saying that. There are certainly criteria that ERs use to decide whether or not someone should get a CT of the brain with a suspected head injury, but the data is overwhelmingly positive that advanced neuroimaging is not needed. CT, MRI, functional MRI, we could go into the weeds, but it's just not going to help in the diagnosis of a concussion. Now, we can even flip further. What about biomarkers? So biomarkers
are there?
There are biomarkers, but are they useful? Remember, we are looking at a clinical diagnosis first, and there's a chemical cascade that happens after the injury, but are we going to spend thousands of dollars when the answer is, no, we just need to stop, take a minute, and breathe. And this is where it gets interesting because you can go to the urgent care. Urgent cares might send you there. At the end of the day, it's a compounding problem in healthcare because of the cost of the care that you're getting, and it's not actually getting you to the point of getting better. So as a parent, non-medical person, it's not inappropriate to call your pediatrician. But you need to understand kind of what Dr. Alo talked about. That pediatrician is not going to take the most linear approach to getting your kid safely back to sport. So what do we do at the college? What do we do at the professional level to get these athletes in? First and foremost, we check on them repeatedly, regularly, over the time. Now,
this is in the acute phase, right? When it happens,
we're talking the
they're
first
on the
couple
side,
hours
they're on the
afterwards.
sideline.
First couple hours.
Okay, after they maybe go home.
Yeah, exactly. What you don't need to do, and you probably remember this, what am I going to say? What shouldn't you do anymore? Wake your kid up every hour.
Oh.
Remember that recommendation they used to talk about?
If they have a brain bleed, that's a different story.
Well, you can just see if they're breathing. You don't have to wake them up every hour. That is definitely not a recommendation anymore. It was when I was training, though, back in the day.
Oh, they told us a lot of things back in the day that have obviously evolved and changed. And that's the other thing. A lot of people ask, well, how come we don't do things the way we did 20 years ago? Like,
because they're probably
every
wrong.
10 minutes, the science changes. There's new data.
Well, it's just every 4 years. So
when the textbooks are republished.
Yeah, so actually it's a consensus statement. So concussions are built off an international consensus statement. I think we're going into the 7th iteration. That's actually happening next year in 2026. Paper will be published 27, 28. Not that
And
matters.
we'll put a link down below where they can download the paper and read it.
Yeah, it's actually a pretty easy read for the non-medical, especially when it talks about the acute phase and the recognition phase. For people like me who've read all of them since day one, little gray behind the beard right now, there are interesting points that they keep adding to. So after that immediate acute phase, the first 24 hours, when I want to see a kid in the office is probably somewhere in that 72 to 96 hour phase. Why? Because historically, everyone has said the thing that you need to do is complete rest. It's completely wrong.
So what would you say? What's your...
So the actual answer, the actual retail price is 24 to 48 hours
of rest.
Of near complete rest, all right? If it bothers you, you shouldn't do it. And here's a real kicker. You've got a few kids, I've got a few kids. Those kids may have cell phones, electronic devices. And you hear this, but it's actually wrong. I'm so sorry.
It's wrong.
I'm sorry, parents. Yes.
So the recommendation.
There is no science behind taking away a cellular device. Yes.
Take away stimulation. Lights, flashing lights, go to sleep, lay in bed.
But here's the issue. We have a generation of young athletes that are so socially connected through their devices that the social anxiety of being pulled away from their friend group actually adds to the burden of disease. So the data backs it up where for only 24 to 48 hours, that shorter period of time, you have to take away their phones and electronic devices. Now, in saying that, if it bothers them to look at the screen, do things like turn the brightness down, wear blue light blocking glasses to decrease the light stimulation that aggravates their symptom from a concussion. But once we get out of that first 48 hours and you're not necessarily getting worse through that time, we actually start to engage in low-level physical activity. So believe it or not, recovery includes activity.
What is low-level physical activity?
Yeah, so it's real easy. So we all know max heart rate, right? And essentially 50%.
220 minus age.
Correct. He's a cardiologist, folks. I tried to give him a cardiology question there. But 50% max heart rate. So doing something essentially where you're not moving your head.
So for most kids that are 20-year-olds, you're looking at a heart rate of about 100?
Yeah, pretty boring. Pretty putz level exercise is the word I use to describe it. So stationary bike where you're just kind of putzing, low level physical activity. A lot of times with kids, I tell them to walk the dog because as a dog owner, parent, the dog always needs walked. It's pretty low-level physical activity because they smell and they're all over the place and all that jazz.
So do lights matter? Do we care? Because a lot of times they tell you, go to your room, turn off the lights, and keep it dark and quiet. Does that matter?
It does, but it matters if it bothers you. If it doesn't bother you.
So if it's not really bothering you, so kind of like if you tear a shoulder, they tell you you can move it to the limit of pain. Like, move your arm. If it hurts, stop.
Yeah, there is a lot. If it hurts, don't do it.
Mm-hmm.
But that also leads into a very important point that we don't want to cover up those symptoms. So what we don't do is we don't have people take, number one, you don't have them take any anti-inflammatories. Reason for that, one of the side effects of anti-inflammatories, bleeding. So if you do have a slow brain bleed, you don't want to add to that equation. And another side effect, headache, something we're trying to actually treat.
You want a headache?
No, but
you do not want a headache.
You do not want to give them additional
headache. You want to give them additional
headache.
Oh, I see.
Yeah, we don't want the potential side effects from the NSAIDs.
Gotcha.
So when we talk about over-the-counter medicines, a lot of the times we're going to say if they have trouble sleeping due to headache, then you can give them a Tylenol. But we try and keep that Tylenol during the day away from them so they're not pushing through symptoms and taking the medicine to cope and get through the activities of the day, such as that. So we talk on the natural side.
So you want to go way less on any medical interventions other than some Tylenol at night, maybe?
So that's where I think there's some value in vitamins and supplements. And I'm not like selling a bunch of things, but we know that magnesium 200 milligrams, great supplement for headaches. That works pretty well. There is some soft science that again, cardiology related, CoQ10, omega-3s, omega-6s, those are all things that can help. They do not help really in the acute phase, but for a brain health standpoint, there could be some benefit there.
Definitely omega-3. The problem with omega, like the fish oils, is most of them don't contain the amount of fish oil they even say, or any.
Which is why I don't recommend them.
Right, I don't recommend them because it's just anecdotal evidence. Otherwise, we put everybody on it. We'd make prescription oils. We have. Yeah. We've made prescription fish oils, and they've failed.
Yeah.
I mean, they don't work. So the insurance makes it $3,000. If you really want it, you got to go pay. It doesn't. The outcomes data wasn't all there. So
I'm more big on the magnesium. That seems to be the most effective.
That definitely in cardiology even does seem to settle down PVCs, heart rhythms, things like that. Even there's definitely evidence of that. So I can see that. Maybe it shuts down some of your brain waves or some of the extra brainwave activity, or no?
I'm just carpenter, man. No. All I do is structure, function, and how things work. I just happen to have some Jedi powers when it comes to concussions. So let's get back on track.
Back on the kid that's a 20-year-old that had a concussion, is at home now. They already saw you or the pediatrician.
Let's talk about that visit. So let's talk about, So what is the difference between what I do and your primary care provider? The physical exam is very different. Very different. There's a lot of things that we check, but a lot of the things that your primary care provider are going to check are going to be normal. You're not going to have a cranial nerve abnormality.
Or they listen to your heart and your lungs.
That happens,
Which is fine. They should do that. I get it. But it's not focused to concussion symptoms, right?
I do have a stethoscope. I know which way the earbuds go. I don't remember the last time I put it on.
Was that the toy one from McDonald's?
No, I actually have my original stethoscope that I got from the POMA, the Pennsylvania Osteopathic Medical Association in the late 90s. So
you got to have one somewhere.
I mean, you can replace the bell and stuff. It's nice. It works. Yeah, I keep one when I travel. It stays in my bag, of course.
You got to look like a doctor at some point.
No, I feel like I'm the anti-doctor of doctors.
Good.
Yeah. So what I do, there are certain tests that we do in the office that are more important. Obviously, eye tracking, very important, but even more important is your vestibular system. So in your
Explain
brain,
that in lay terms.
I got you.
I'm sorry.
I got you. So just like when your cell phone turns on its side and the screen changes, your brain has crystals in your ear. That sounds crazy when we use the word crystals. That's 100% accurate though. That's like an accelerometer and a gyroscope. And when you focus on an object and your eyes are moving and that object is moving, that's a test of the vestibular system. And we test it in multiple different ways. We test near points convergence, which is your eye's ability to focus on an object as it comes close to your face. In addition to that, we look at balance. And what's awesome is that back in the day, 20 some years ago, balance used to be just tested with, well, your balance looks good. But with the kind of the technology where you're looking with your cell phone that kind of turns on its side and stuff like that, that gyroscope and the accelerometer, we are actually accurately able to calculate if you're truly off balance. So the technology is way better at assessing these things. The other thing that
this is a test with your phone?
Yeah, there's a bunch of tests with your phones.
Oh, so you have them wear it, or what do you do?
No, you just kind of hold it right on your chest there.
And you have them do a skill, or what?
Yeah, so it's called a BEST test, modified BEST test, balanced air scoring system. Wow, I remembered that. And developed at the University of North Carolina, Chapel Hill. Again, don't know why I remember these things.
That's why you're a doctor.
It's that things that we have in the back of our heads that we just bring out every now and then. People are like, oh, wow, you do know things, right? But yeah, no, the actual scores and the errors for that have been accurately calibrated with the cell phone. Any Android, Apple mobile device can do it.
So they hold it and you have them do what? You have them
single
walk?
Leg balance. They do some
okay. So you have them do some things.
Yeah. So
single leg balance.
Yeah. So we
close your eyes, maybe.
Closed, eyes open. Just both feet straight on the floor, palms out, eyes closed. And it's something that we use in professional wrestling. We use these products actually post-injury. So case in point, there was an athlete that had an injury to their face and head. Even though they checked out, they answered all the questions correctly, seemed completely normal, just had more jaw pain than anything. We still did the concussion test of checking their balance, even if after a full evaluation, just to make sure we're not missing anything, because those are actually more accurate than our eyes.
Is there any situation where you would tell a parent or a kid, you can't play for like an extended period, like you're out for a few months?
No.
Never.
No.
Even if they like concussed and were vomiting and all kinds of craziness?
No, you want to know why?
Why?
There's no data to support that statement.
So what's the longest you would keep anybody out? Or how short is it?
Well, short, that's an easy answer.
You got to take them out those first 72 hours, you said.
Not
right?
necessarily.
Not
What if their
necessarily.
symptoms resolve in 24 hours? They can start their low physical activity right away.
But I mean, like getting back to play, contact sports. They do the walk the dog thing and all that. Then
I mean, there's a full return to play progression that is 5 steps.
Talk me
I
through
knew
that.
you were going there.
Let's do that.
Let's go there. Yeah. So return to play is a very structured, very research.
This is assuming they passed all the stuff that you said, the low level office stuff.
I'll actually run through the whole thing.
Fire it.
Yeah, so even here in the state of Ohio and Michigan, and I'm also licensed in Pennsylvania, I'm 99% sure they have the same basic thing. Return to play is standardized based on the international recommendations that Dr. Alo will share the link to after this podcast. And in there, it's really a 5 or 6 step process depending on how you want to do the math. The first step is the low level physical activity that we touched on a little bit earlier. Second step, which is 24 hours after without significant increase in symptoms. What do we mean by that? No more than 20% increase in your symptomatology. The second step is increasing that physical activity, going from no head motion to adding head motion. So if you were biking for step 1, you're going to be jogging for step 2. And we're going 30, 45 minutes. I mean, we're doing some real good. You're doing your 60% max heart rate for that second step. Third step, you're going to add some resistance. Reason for that is no matter how hard you try, you're going to know the statement. People hold their breath when they lift. Even the best of us.
Oh, yeah.
Yeah, exactly. So what that does is it increases intracranial pressure by holding your breath, pushes some blood flow up into your head. Provided you do okay with that, you don't get dizzy, don't get headache, not a big deal. You're able to move on. And you can also add some we do a lot of burpees at step 3.
That's quite a bit of jumping up and down.
Oh, yeah, we push. Step 4 is non-contact activity. I'll go back to what I do. I have worked with our athletic training team at AEW to build in-ring return to plays. And, for wrestlers, they are doing a lot of climbing of the ropes, up and down, some jumping. The wrestling ring has a lot of bounce to it, kind of like a trampoline, a soft trampoline. So just getting your footing on that. We sometimes progress to what's called chain wrestling, in which you're doing moves, but not getting thrown on your back or head or anything like that. And then step 5 is a full contact practice.
Practice, not a game.
Not a game. You should not be doing step 5 as a full game.
Gotcha.
Now, obviously, there's some bending of the rules. It's different for an NFL player.
You could but you could always tell a coach, put them in for a few minutes and see how they do, or no?
I would prefer not, honestly.
So when you release them to play, you want them to go back to you're fully ready to go.
Yeah.
Okay.
Because what you're not thinking of is the psychological side of that. So you have an athlete that's been out for a period of time, and I can tell you as there are different age groups that respond differently to injuries. So one of the hardest age groups, probably I'd say 12, 11 to 14. It is my just give it 2 weeks, folks. It's great advice, by the way. So just in case, hey, when do I know if I need to take him to the doctor? Well, if it's been 2 weeks and their ankle still hurts, I probably should see him, all right? But usually just give them 2 weeks. They've never been hurt. They don't know what it's like to be hurt. They need some time to get back. They need that mental recovery. But you also need the coaches to get the confidence back into them that they're good, they're ready to go, they're good to get out there. So it's a confidence on both the athlete and the coaches to know that they're back. On top of that too, what if you get into a situation, and I've seen this in athletes where we've had them do something that we're like, that shouldn't set you off, and it increases their symptoms more than we would like. So this
is before they go back to play.
This is literally right at the last step.
And if they do something and it kind of throws them off a little.
Yeah.
Like, for example, when they're doing their burpees maybe.
Yeah, exactly. Forward rolls.
They get dizzy or they get a little wobbly.
Yeah.
Okay.
Yeah, or they get hit and they're like, whoa.
They just something's not
chipped
right.
off the shoulder kind of thing, Where they just, like, hell on, I need a minute. So it gives just an extra ounce of protection. So let's go into the fact of, why don't I say a certain amount of time to be out, right? So we can talk about averages, and the average is about a week to 2 weeks. 10 days is a very safe answer for most concussions. There are a bunch of concussion modifiers, mental health disease, migraines particularly in the maternal side of the family, learning disabilities, dyslexia, ADD, ADHD, history of seizures. That literally just checks all the boxes real quick, by the way. And there's also like confounders, like we know you have, we'll use a wrestling example. We have a pay-per-view. Pay-per-views are big events. You pay like $50 to watch. Shows are crazy, insane, awesome, amazing, super fun to watch, particularly person. But you have a big event coming up, a championship game, a state championship, and you want to try and get back quicker, right? And that adds to the stress of the injury. But we also talk about numbers of concussions, because here's another, probably the most common question that I get, right? Doc, they've had 3 concussions, they're done.
So I was telling you a story earlier. During residency, I had attended a lecture of somebody talking about concussions. They said if an athlete has 1 concussion, fine. They have another one, they're out for like 7-8 months, like automatically. Is that true or not?
Not at all.
Talk us through the multiple concussion type athlete.
Yeah, so there's not a number. And if your doctor tells you a number, you probably should consider finding someone that might know a little bit more about the injury itself. And the reason I say that is... So
literally a doctor would say to you, if you've had 2, you're done playing sports altogether? Or done for the year, the season, whatever?
Pediatricians here in this town that would say that.
Oh, definitely. I mean, I've heard this before too. So that's what I'm asking.
Yeah, it's not real. Because what we found out and what we've seen when we look at the science about this is the fact that the issue isn't the number of concussions. The issue is how you recover and making sure you do a full and complete return to play. And you are all the way back before going back into sports. That is the most important thing. So the numbers, they're important. Yes, they matter. How your previous concussion does give us a little bit of an insight in how your next one's going to be. If it took 2 or 3 months for your last concussion to go away, it might take a little bit longer than normal. But it doesn't necessarily mean anything, because each individual injury is separate and it needs to be treated as a specific singular event and moving forward with still understanding the previous history. So
it really depends on the severity and how long the original concussion lasted. Because you said some of them can take up to 2 to 3 days, some might be a couple of weeks.
Yeah.
But is there evidence that the more prolonged the recovery, like a guy who takes 2 months to recover versus a guy who takes 2 days or 3 days, what is their recovery like? Is it worse? What's their outcomes look like, 5 years from now? Like with the whole, CTE, chronic traumatic brain encephalopathy, whatever. Yeah. Somebody has a mild concussion that's back to play in a week versus somebody who takes them 2 months to get back. Long term, what does that look like?
Yeah, so let me just hit this. There's no such thing as a mild concussion. It's like you're pregnant or you're not pregnant. You're concussed or you're not concussed. There's no ifs, buts, candies, or nuts between that. So concussion is just a concussion. And
I meant maybe more in terms of like how long the recovery is.
I understand, but we have to be careful.
You have to be careful with the language, of course.
Because I hear it all the time. Well, doc, it's just a mild one. I'm like, no, it's just a concussion. And yes, I think that history does give us a insight on what the future might look like. However, it's not an absolute. There are multiple domains of a concussion, and certainly there are domains like the visual domain. If a lot of your symptoms are eye related, that is very much a slower return to play.
Do we know why?
I don't know. I'm not an eye doctor, bro.
I gotcha. Okay.
Yeah,
but see, at least you're honest. You're not making stuff up.
No.
A random person, some people is not ethical, whatever, probably just make up an answer.
Well, I mean, I think I can postulate quite well. And the reason is that, your eyes are a very complex system. I mean, they have their own dedicated cranial nerve, plus the cranial nerves just to move them. So, I mean, it's
tendon muscles and everything.
Well, exactly. It is an extremely complex system. When that system gets thrown off, and when we look at the optic chiasm in the brain,
where it travels through, exactly.
Yeah, and it crosses over, it can be extremely difficult because of the location. And being more central, it's probably more of the severity of the injury. At the same time, too, we didn't do as great of a job, probably up until the last 5 years, working on the recovery for the eye. So there are exercises that you can actually do to help from a concussion injury to help with those eye movements. And historically, as a sports medicine, we have not pushed those as much as we do now. So that's part of the recovery process now, is that we didn't treat it as well. And sometimes you need to go see a vestibular therapist or ocular therapist to help get through those types of injuries. And the vestibular is right after that balance system in the inner ear there. When that's off, you have to get it right before you can get back out there. And sometimes you need that physical therapy to do that. Head concussions, those are pretty easy. Headache concussions, those aren't bad. Cognitive ones can be in between.
So the worst is the eyes, then the ears, necks, headaches.
Yeah.
So then would you say, as a general rule, if it takes an athlete longer to get back to play, if they have a second concussion, it's going to be worse, or they might have more long-term down road?
It depends on what systems are affected. So if it's a headache only,
so if it's ocular, for sure it's worse.
Probably going to be longer. Yeah.
Gotcha. So it's more the systems that are affected than the actual return to play length of injury or whatever. And long term, what happens? So somebody has one concussion versus a kid who's had 8.
Yeah.
Long term CTE, encephalopathy, all that. What are we looking at now? What's the data show? Because in the NFL, they didn't even believe in CTE. Like my friend, my friend was actually the president of the NFLPA.
Yeah.
And he would tell us like the NFLPA is fighting for the players and trying really hard to get the testing and doing studies and MRI imaging and all this stuff on NFL players because they get hit so often, versus the owners are trying to say, no, there's no such thing. And they push data and studies to say that there's no such thing as CTE. So what does the data kind of show on that?
Yeah. So first off, CTE is a 100% real pathology. In saying that, we still struggle to fully connect the dots between CTE and concussion. And I think that's very hard, because anecdotally, like we'll look at Junior Seau. I think that's a great example. There's no doubt that man played with multiple concussions.
So explain to people what happened to Junior Seau.
Yeah,
he was a linebacker with San Diego.
Yep, San Diego Superchargers. Pretty freaking good, man. And I think he's early 50s, right?
Yeah.
Unfortunately, very sadly, tragically took his own life.
And he said in the note, this is why they think it's related, in like the note that he left was like, please take my brain, I want to donate it to science so they can study it and see what happened with, the whole injuries or whatever it might be.
Yeah.
So that's why it triggered that sort of thought process. Like lots of people commit suicide. We don't always think it's CTE related or what have you.
Yeah, and it's super tough, and it's it can be a very touchy subject. I think that where I'm going to stand on this is very neutral in saying that there is a relationship. We still need time to figure out what that relationship actually is. And the more we can understand the relationship between concussion, repetitive concussion, healing from concussion, and the pathology of chronic traumatic encephalopathy, the better off we're going to be at preventing it.
So as of right now, we're not sure the two are related? Or they are?
I feel like the answer is we're pretty sure they're related, but we
just
don't know how.
Yes. I see.
Yeah.
So then another theory, obviously, is called traumatic,
Yeah.
Chronic traumatic encephalopathy. Is it just due from the shaking? They may not have had a concussion, but the shaking, the shearing forces, the brain rattling around in your
Don't
fluid
forget the
in your
chemical
head.
cascade too that happens with that injury. Yeah.
So are we thinking it might be more mechanical versus the concussion type stuff that is obvious? A guy might go play his whole career and never really have an actual concussion, but because of the pounding, like what happened to Muhammad Ali, the pugilistic encephalopathy, the pounding of your head your entire life, you end up being almost like demented, confused, slow at talking.
In nature, yeah.
Do we think it's more traumatic, or we're just still really not sure?
I would love to say that I think it is more of a trauma, a bleed, and then a miniature bleed, and then injury thereafter. But again, I'm a simple carpenter. I just know the simple stuff. I am not a full neuroscientist. I have an exercise physiology degree. I'm a meathead, so I'm not going to try and sell you on something. No,
it's totally fine, and that's a perfect answer. Yeah. If we don't know, then we don't know. There's a lot of things that we don't know, obviously, especially for the brain.
Yeah,
I mean, it's not like one of these things that's super easy to understand. There's all these neurons firing, complex. And who knows. So what would you tell a parent, like how to advocate for their kid? The kid looks funny on the field.
Yeah.
You saw them fall, because everybody watches their own kid. The coach is kind of watching everybody, but you're watching your kid or your daughter, and they fall over, and something just doesn't look right. what would you recommend or say to parents if the kind of the people on the field may have not have noticed?
So first off, we need to eliminate the stigma of concussion. This has been years and years. Dr. Alo and I suffered from stop being a baby, get back out there, pop an aspirin, get back on the field. These are not that uncommon, unfortunately, today in 2025. So understanding that the best way to take care of your child, the athlete, the injured, is recognition. We know from a great study from the University of Pittsburgh that if you had an injury, continued to play sport, and then had a second injury, your recovery time increases by 50%.
If you didn't stop. If you just continued playing that same game.
It gets worse.
Gotcha.
That much worse.
That makes sense.
I
that
know.
makes a lot of
Again,
sense.
you can't tell my wife it makes sense. She might be listening.
I'm sure she'll watch this someday.
I'll tell your wife, though.
All right. I'm sure she's due to see you anytime soon.
I mean,
We're always in your office.
always happy to help. So number one is recognition. And if you don't feel comfortable, unfortunately, and you know this as a coach, there are often contentious relationships with coaches and parents far beyond what they probably should be these days. But, taking a minute to just talk to your kid, give them a minute, ask them to be pulled out of the game. Athletic trainers are amazing resources. March is National Athletic Training Month. So thank you.
It's my birthday too, actually.
Happy birthday.
No, but when I'm on the sidelines, if a parent comes down and wants to talk to their kid or grab them, whatever, I have no problem with it whatsoever.
Yeah.
Never. It's never an issue.
Yeah, please let them do that to the other coaches that might be listening.
Yeah, absolutely.
But just talk to your kid.
Because you're watching your kid.
Yeah.
You see it. I don't watch I'm a coach, but when I'm watching my daughter play, I'm watching her. And I'm recording her and I'm making sure, she looked good. Look at that pass, whatever. You're watching your kid. I'm not watching the goalie trip and hit the post and fall over on the other end of the field. But that person's parents are watching them. So you would also recommend same thing. Go down there, be like, hey, go grab her. Something's not right. She fell. She's walking funny. She doesn't look right. You would no
if there's
no
an athletic
question.
trainer, bring the athletic trainer into
Yeah,
the equation.
absolutely,
Yeah,
of course.
Great resource.
Absolutely. That's what I would recommend. I have no issues with that at all.
Yeah, and I think be an advocate for your kid. Don't be a hindrance to their health. Make sure that you are giving them every opportunity to let them know that you genuinely care about them. Their brain is important. This sporting event, whatever it may be, is not nearly as important as their health, their brain health going forward. And you don't have to use those words, but just be like, hey, you good? What's going on? What are you feeling? That looked a little sketch. What happened? Ask questions.
Sometimes
in words they understand.
In the world of football, we have the opposite effect. Like a kid gets injured, and I'll tell them to go sit out. The trainer takes them out. Not even me. Like the trainer comes and gets them. The dad will come up on the sideline, and be like, "What? You want me to take you to the ER? Get back in there. Why aren't you playing? Go tell your coach you're ready to play." Like we have that on the total opposite end. Obviously, everything in between, but we have that on the other end. In concussion world, it's probably different if you bruise your leg and if you're not
if you think
broken.
about it, it's a brain bruise. You think about it.
Yeah, that's what I'm saying.
You can think about
the brain is not that easy for a parent to understand. Like if you hit your leg and you're able to walk or jog on the sideline, you could probably play.
Yeah, but
if you hit your head and you're weird and you're not acting right,
yeah,
a parent doesn't know how.
No, but this is super important. What I always do in my office visits, and I hate using the word hate, I just use it again. When parents are on their phone when I'm doing the exam, my job as a physician is to find the physical exam signs of that concussion, and I want the parent to see that.
To see it, yes.
Yes, and I want them to see it because I want them to see if that kid has to come back, what normal and abnormal is. Hey, your kid doesn't look right. Look at this. Stop calling them soft. They can't walk in a straight line. If they were to drive a car or field sobriety test, they'd probably fail it, so maybe they shouldn't drive. I genuinely care about your kids and your athletes. We try to treat all of our patients as if they were our own family or friend because that's the right thing to do.
Right.
And the right thing to do when it comes to a sport-related concussion is to take the time to listen to the athlete, take them to someone who knows what they're doing and can give you good, if not great, medical care and advice, and then help them recover successfully so they can safely return to sport.
No, I totally agree. Is there anything we've missed that you think in your years of doing this? Now you're in Northwest Ohio.
Yeah.
I've not seen or met anyone else in Northwest Ohio that does this. Is there anybody else in Northwest Ohio that does what you do?
Yeah, no.
Did you had to do like specific certifications for this?
Yeah, I do have those too. Yeah, so
Well,
not only the fellowship,
but explain that part so that if somebody's interested in this that is a doctor listening, because I have a very medical audience. If someone wants to get into this, do you have to be sports med? Can you be internal medicine, pediatrician, family practice? What do you have to do to get to this point?
Yeah, I have a bias. I have an implicit bias here.
Sure, we all do.
Because, I mean, I'm a primary care sports medicine doctor. I think it is one of the coolest subspecialties. Obviously,
Absolutely.
Again, very biased. I'm not smart enough to be a cardiologist because I can't do plumbing. Don't ask me to install your toilet, folks. Just a carpenter. It's a little bit of electric work. All right, again, carpenter, electric, plumber, guy does it all over here, right? But I think the most important thing for medical professionals, number one, understand the literature. Look, we're taught to be treating based on evidence. And unfortunately, when we talk evidence to patients, we know that's not effective. Making a personal connection is much more effective than just shoving evidence down their throat. But as clinicians, reading the evidence is the most important thing. The most recent concussion guidelines came out in 2002, 2003. It was the Berlin.
That long ago?
Yeah. So the problem is
I thought you said there were more recent ones.
No, it's literally, it takes a year and a half to publish a consensus.
2002 or 2022?
22.
Okay.
Yeah,
I thought it was like
bad.
over 25 years ago. Okay,
I'm a little sleep deprived, folks.
No, 22. That makes more sense now.
Yeah,
I got you. So like a couple years ago.
Yeah. Because so they'll have the consensus meeting in 2026. I think it's in Paris. Don't quote me on that one. I don't go. And then it'll take 18 months to get to an actual paper that's published, typically in the British Journal of Sports Medicine. So historically, British Journal of Sports Medicine, Clinical Journal of Sports Medicine, probably the two top sports medicine literature reviews out there. I would go to those as your resource. When it comes to sports-related concussion, a lot of the stuff that is published by the governments are actually straight from there. The FIFA guidelines also come straight from there. FIFA does a great job, even though we all know it's corrupt, putting together the medical science of sports concussion, and the International Ice Hockey Federation does a pretty good job as well. So those are a lot of the main organizations. We also see the NFL drops a lot of literature too. But
they finally came around to it because they realized the players really want it, and you're not going to get player buy-in if you're not advocating for your own player safety, which is why they've changed a lot of they got the soft helmet covers now.
Yeah, you want to talk about that real quick?
Fire away.
I do.
Absolutely.
I do want to talk about that.
I had a bunch of kids wear those.
Yeah, so you're talking specifically about things called like the Guardian caps.
Guardians, yep.
Yeah, not a fan.
Not a fan.
Not a fan. I know. That's why I threw a curveball at you right there.
I had about 2 or 3 kids this year that wore them.
Yeah. So there's concerns, and there are other products that are probably a little bit better. The Guardian cap is essentially a padded helmet over your helmet, an over helmet.
It's like an inflatable, almost puffy,
Yeah, it looks like a down coat, honestly.
Yeah. All right.
Yeah.
It's like a sleeping bag for your helmet.
A little bit, yeah, except probably more protective than a sleeping bag.
It's a little harder, not so soft.
It is a good product at reducing the amount of actual force with
transferred force.
Transferred force, the actual forces. There's some value, particularly in practices, particularly in linemen, offensive, defensive linemen, where that is helpful.
That is very true. It definitely helps. The number of reps you get hit makes the biggest difference. A lot of football teams, youth level, high school level, NFL, even college, they've gotten rid of some of the drills. You cannot do Oklahoma drills where 2 people running at each other through a narrow tunnel, full speed, head on. They've gotten rid of a lot of that. Now they recommend thud tackling in practice. Because then your running back would die.
Yeah.
Like if I had my running back.
Back when you were running back?
That's what I did. Back when I was running back, they tackled me on every play. Yeah. You would literally die from practice. The games were like a vacation because almost nobody got to you, or
but
just
you
a couple of times.
For it.
You were absolutely conditioned, but it was like torture. Yeah. But now, like my running backs and even certain players, you're only allowed to thud tackle them or like wrap them up and give them like a little bump. You're not allowed to tackle them to the ground. I mean, they've incorporated so many rules at the youth level. High school level. I don't know that everybody implements it, but you're supposed to. Like they sent you the rules and what the guidelines. You cannot have people tackling each other to the ground 100,000 times every practice because it's like every night you're tackling everybody, blasting them to the ground.
But that's what the Guardian cap's good for. The Guardian's cap is good in practice to do it. Now, what I get concerned for when we look at the science, which the science is not as strong as it could be. It is not an FDA approved
Do we have enough
device.
data to say that the science?
The data, yeah, I think it's there.
We do. Okay.
Because, I mean,
so it's not a lack of data. We have the data. We just,
it's not
it hasn't been good.
It's not a medical device.
It's not
so
good
then
enough.
here comes the issues. Number one, if you're wearing that in a game, you might as well put a bullseye in your jersey. You know, I mean, am I wrong? You're a coach.
No, I don't think so.
That kid,
I think people have gotten over that. Like, he's not the soft kid, or his parents are
It's
soft.
not about being soft. It's
No, I know, but like you might think
prone injury. You know, and we can go with that.
I don't think, at least not at the level that I coach at, the 5th, 6th.
But it doesn't give your athlete a false sense of confidence that they may be able to use their head as part of a weapon.
That may be a little bit. It could be true. But I don't think other kids are going to target the guy with the soft, weird looking hat. Although you never know, because these are kids.
So let's talk about something that actually does have some research and FDA backing. All right.
Yeah.
So have you seen a Q collar?
Is that the big wrap around the back?
So it wraps around the neck.
Like Brian Cox used to wear those.
No. That's a cowboy collar.
Okay, this is
Q
different.
collar is a device came out of the University of Cincinnati, and what it does is it increases intracranial pressure by putting some pressure on the valgus.
Is it like that little magnetic kind of tight wrap?
Not magnetic. There's no magnets here. Yeah.
I had a kid wear something around his neck. I don't remember. Oh,
it's
no,
probably it's about $100.
I had one
$200.
kid that was wearing a little tight thing around his neck. Maybe that's what it was. I had no idea what it was.
Well, yeah, no. So it increases.
I think it keeps your neck kind of straight.
No, it doesn't do that.
Not at all.
Actually.
Okay, you're the expert.
It puts
on this.
a little pressure and it increases the intracranial pressure. So it gives your bag of fluid in your brain. It makes a little bit cushion inside the brain. So that's an FDA approved device that actually has been shown to decrease concussions.
That's fantastic.
Yeah, and that's where look, we're doctors. I know I don't look like one. I like to wear jeans and a polo at work because I'm the chill doctor. He's a serious cardiologist. That's cool. We all have roles to play, right? But I want to bring out the things that actually work, that science
Absolutely.
backs up,
I'm all about evidence. Well, if it doesn't work, it doesn't work.
Well, it's not saying it doesn't work. I think there's value in the Guardian
But
Cap.
there's
I just
not
don't love
enough
it.
data yet.
Yeah, Q collar, we have data.
Okay.
We have data. This is an FDA approved device. It actually works to increase intracranial pressure. There is a decrease in concussions from that. The other thing you do is training, eye training. Similar, if anybody watches F1, I love F1, sorry. The eye tracking and speed tracking type stuff, super great for coordination and eye motion.
So it's like something flying across the screen, you're tracking it? Or like how does that work?
You remember like the dots on the wall that light up and you've seen type of those things fast? Okay.
No.
Really? I feel like as a coach, he knows these things. But
no, I've never seen that.
Yeah, no, like reaction time.
Oh, those things. They light up randomly. You got to touch them.
The same thing, like if you have like the 5 colors, you drop and catch it real quick.
You got to do your eyes on it. No, this
but
is
you
like
are
you
doing
actually
your
touch
eyes
it.
with it. Like, because you have to move your eyes quickly.
Right. Or like you drop the whatever and the kid has to catch it.
Yeah.
We have our centers do that.
Yeah.
They snap the ball and then they got to catch the thing that the guy's dropping so it doesn't hit his head, so he doesn't get hit in the head.
See, those things actually
like that.
work.
Yeah. It's like quick coordination type stuff.
And obviously neck strength. So what's probably the most important thing for young athletes, Dr. Alo, who coaches late adolescent, early teenager.
10 to 14, sometimes 15-year-olds.
I'll take my numbers. That was a good statement.
Very
late
good.
Adolescent to early teens is neck strength. So we know helmets weigh about what, 3 pounds, 5 pounds?
2 to 5. Yeah.
2 to 5,
depends. They're lighter and lighter nowadays.
They are, but if you don't...
We tell them, actually, this is a good point. We tell them to wear their helmets at home for the first few days so their neck muscles get used to carrying a bigger head or a heavier head.
Yeah.
So their neck muscles can get stronger.
It's that Jerry Maguire. Remember that little kid, the human brain weighs 8 pounds? So you put a 5-pound helmet on it. But getting a little bit stronger in the neck and being physically able to. I mean, I was a tiny kid. I mean, I graduated high school. I was probably about like 5'8", 5'9". And then I found the weight room in college.
Yeah, same thing. So there are some devices. What about the mouth guards? Is there anything special with the mouth guards?
How much do you like your dentist?
Well, other than tooth injuries, do mouth guards help prevent concussions? Somebody, I don't remember where I read this. They had mentioned that we tell them to wear the mouth guards not just because to protect your teeth or lips or you bite your tongue, but also to when you clench down on it, maybe it increases intracranial pressure or something. Any data to support that?
Some data is soft.
Not really.
Yeah, no. I tell kids for teeth.
So they have to wear them.
Yeah, well, they have to actually wear them correctly, though. That's what you're trying to teach them to do, right?
Well, at our level, if it's not in your mouth, the play's dead.
Okay.
So, but obviously in high school and college, they don't wear them. They just
it's
hanging there.
They don't have a special color for the game, right?
No.
Yeah, they have those little teeth.
I bought a box of 36 cheap ones from China, and I gave it to everybody.
Yeah. No, kids will not.
I don't even think it was China. It was Amazon. I don't know where it came
It doesn't matter where it came from, right? Because it's probably tariffed now. But what matters is the fact that kids aren't going to listen to you when you say, oh, this is going to prevent a concussion, wear your mouth guard.
True.
But if you tell them, hey, if you want busted teeth and you don't want to go to the dance with all crookedy teeth that are all falling out, and this is someone who has 5 broken teeth that are capped, wear a mouth guard. They're probably going to listen to that. Yes, there might be some added benefit of potential prevention, but it is definitely...
That's very similar to smoking. They have found that if you tell smokers your breath's going to smell, your teeth are going to turn yellow, your hands are going to be wrinkly, and your face, they're less likely to smoke. If you tell them you might get cancer in 60 years.
Yeah, cancer is not an effective tool to get people to stop doing things. Just like heart disease, right?
Right. Oh, tell me about it. No, that's good. Is there anything you think we're missing that you want to add to this discussion?
No, I think people have heard me ramble for probably too long.
And I'm sure if people have questions, they can drop it below. You're on all my socials. I'm on his. We can answer questions. He can answer the questions, and we'll do that. I appreciate it, man. This was awesome.
Yeah,
this
was so
really
good to see you. Happy to help, and hopefully we were able to share some interesting, informative, and semi-entertaining advice tonight.
I think it's very eye-opening when you realize how much has changed since we went to play sports.
Yeah.
It was like, oh, you're out. You're out.
It's like there was no long ago, but it's really ages ago.
Well, there was like no rules. It was just like, all right, you're out. You got a concussion. Sometimes back then it was like he never had a concussion. Leave him, let him play. But eventually they started recognizing it, and it was just like you're out for good or you're out for this much. There didn't seem to be a systematic, evidence-based way of dealing with these things. Now that we have that, it's going to keep evolving. Obviously, anything with the brain is probably going to keep evolving because we learn more and more every day. So I'm glad we had this conversation. I think it was very good. What do you do for fun? Obviously, you do the wrestling thing. What do you do in your own time for fun?
Yeah, see, that goes back to that weird, the fly sports soccer. It's not because I'm that cool.
Do you fly fish or something?
I'm a professional fly fisherman. Yeah. So
there we go.
I work with a rod company to basically get cheap, free stuff. Fly fishing is a great outlet for your mental health. Something you could do until the end of days, regardless of your medical condition. Wading in a river for an hour can burn up to 1,000 calories, so it's a great form of exercise.
Have you fished in for the walleye in the Maumee River here?
No, that's gross.
No,
yeah,
that's gross.
Yeah, sorry, not sorry. I don't fish in water that's brown. Yeah.
Okay.
But yeah, no, that's my jam, and then I work a lot. Like you probably.
Yeah,
right?
we work a lot. I don't even know how we made this happen, but either way, I appreciate it.
Late at night, folks.
Yeah, it's very late. But anyways, I appreciate it. Like I said, we're going to share this everywhere. Drop your questions below, and I appreciate it.